Hi, everybody. My name is Bailey Collins, and this week, week 4, we talked about nutrition, digestion, and feeding. For week 4, I will be discussing the disease colon cancer, which goes along with digestion. So, what is colon cancer? Just a little background information on the colon. The colon and rectum are what make up the large intestine, and the large intestine is part of the hindgut, which is a segment of the tubular digestive tract that we just read about in the book. And the colon absorbs water and salt from the leftover food that goes through the small intestine. Now, back to what is colon cancer. It is cancer that is found and starts in the colon. So, also, our animals, like our pets, for example, your dog or your cat, are susceptible to colon cancer as well. Here in this diagram, we just see an example of the colon in the human body and what it looks like. So what causes colon cancer? Typically a mutation in the DNA. These mutations can be inherited or acquired. Mostly they are acquired. It's not very common for them to be inherited or passed down. And these mutations these mutations cause the cell to not know when to stop dividing or growing. And colon cancer usually starts in the innermost layer, the mucosa, and cells grow in the mucosa and they can spread throughout the layers. They can go through all of them or just some of them. And if they do make it through all the layers, they can also spread to other organs throughout our body. And typically, the stage of colon cancer depends on the growth of these cells. And colon cancer stages typically range from 1 to 4. Here we see on the left a diagram of the layers of the colon. Here we see the mucosa, which is the innermost layer. Then we see the submucosa, the thick muscle layers, the subserosa, and the serosa. On the right, we see an example of what stage 1 colon cancer would look like. We see the cancer and it is only grown through the mucosa. So that is the innermost layer and it's only stage 1. And if it were to spread throughout the submucosa, the muscle layers, or the serosa, then we would see stage 2, stage 3, or stage 4. So what are symptoms of colon cancer? Common symptoms include diarrhea, constipation, change in stool consistency. Blood can also be found in the stool. Gas, cramps, pain in the abdomen are common as well. And also weight loss that's usually unexplained, and fatigue or weakness. Here we just see, diagrams or examples of what those symptoms look like. So how do you go about treating colon cancer? Common treatments include surgery or chemotherapy. Drugs are also a possible treatment. They are not as common. The drugs can be taken orally or injected directly into the bloodstream. So depending on the stage, your treatment can differ. Usually surgery is typically used for earlier stages of colon cancer. And it is possible for the surgery to completely remove the cancer. And sometimes surgery is typically followed by chemotherapy. Now, just because the surgery can completely remove the cancer does not mean that the cancer cannot come back. So that basically, actually, one more thing I forgot to mention. There is a way to prevent colon cancer. Screenings are very common to be annually done to older men, because it is typically found in older men. And these screenings can find these cells before they form into cancer, and that way they can be removed before even turning into cancer. But these screenings are what allow us to find the cancer typically. Now that sums up what I have to say on colon cancer. I thank you for listening, and I look forward to seeing the rest of your guys' presentations. Thank you so much.